All set to start this day. So for the first session, we will get right on to it. I would like to invite our chair, Dr. Vinita V Nair, who is an MD consultant pediatrician. She's graduated from KMC Mangalore, and she spent some time at St. Roosevelt Hospital in New York, and then followed by her fellowship in clinical hematology in Albert Einstein College, and she's worked as a pediatric consultant in NYC for 8 years. So she moved back to India in 1990, and in addition to being a very, very experienced and senior pediatrician, she's also highly spiritually inclined. I invite you, madam, onto the dais, and please begin the session. And one reminder to all the speakers of this morning, we are in a rush and we want to be on time today, so we would greatly appreciate if we keep to time. So since you're all used to this announcement from me, I don't think it comes as any surprise. So enjoy the sessions and have a nice day, everyone.
Om Gurubhyo Namaha. Good morning, ladies and gentlemen. It gives me great pleasure to welcome you all to the second day of this colloquium on yoga in life sciences and beyond. As we all mature and become wiser, we realize it's not just diagnosing diseases, prescribing medicines, and doing surgical procedures that make one healthy in body and mind. There are a lot of other hidden healing powers that the human body and mind possess. That plays a pivotal role in curing a disease and making a person feel well. This is where yoga is connected to human health. By training the body and mind to be calm and restful, you can fight many diseases more efficiently, especially the so-called lifestyle diseases. This is why we have to introduce yoga in every specialty of medicine. With this small introduction to yoga and medicine, I will come to the first speaker of the day. She is Dr. Anju Namasivaya from Bangalore. She completed her undergraduate training at Bangalore Medical College, trained in Obstetrics and Gynaecology in the United Kingdom, obtained MRCOG and FRCOG. She has a subspecialty training in fetal medicine and worked at John Radcliffe Hospital in Oxford. Currently, she is practicing fetal medicine and high-risk obstetrics in Bangalore. She will be talking to you about the role and impact of yoga in obstetrics and gynecology. Dr. Anju.
Good morning, everybody. Elrigu namaskara. Thank you, everybody, for being here first thing Sunday morning. There are nicer things we could have done, probably, is it? I would like to thank the organizers, and particularly Dr. Manjunath, for giving me this opportunity. Ma'am has already mentioned that my background is obstetrics and gynecology, and right now what I'm doing is a subspecialty in obstetrics, which is fetal medicine. Basically, pregnancy scans, high risk of pregnancy, and babies with problems which we diagnose during pregnancy, and if we can help those babies with good outcomes. So when we were training and we were junior doctors, just imagine we're about 21, 22 years old. We're working on a busy labor ward, and you're on a night shift. You do have senior cover, but the seniors might be dealing with more complicated cases. Maybe they are in the theater, maybe seeing patients who are really serious in the ICU. Then as a junior doctor, if a lady who apparently looks about 7 months pregnant, she looks as if she is in labor and walks through your door, my heart will sink if I was that 21, 22-year-old doctor who was new to the specialty. So that's when, we would do the basics, what we learned during our undergraduate training in terms of, taking a history, checking the vitals, checking pulse, blood pressure, going through her file and understanding what kind of pregnancy it is and understanding what is the basis. And then at one point, blank, because I really don't know what to do next. And I don't have anybody around me to ask. And that's when your experienced midwife or experienced nurse practitioner comes to your rescue. And then she brings about that algorithm for you, which is stuck on the wall of your labor ward. And that sort of briefly tells you what to do. And I'm not too sure, it's not very clear. So for example, if the mother is less than 6 months pregnant, what to do? If she's 7 months, what to do? If she's 9 months, what to do? And that sort of keeps you right. And where did this unit protocol come from? It came from a national guideline. So one of these that I have displayed here is from the Royal College of Obstetrics and Gynaecology, who have put forth this. This is a very simple example where the woman has come with her waters broken and she's in preterm labor. So this is what sort of unifies the whole system together, where decades of research has gone in, and then they come out with evidence base to tell us what is probably the right thing to do, and which keeps you right. So is it new to us? Not really. We've been doing it from times immemorial. And our unit protocol was where our parents, our grandparents, our teachers, and we've all heard, this is what is said in Ramayana, this is what is there in Garuda Purana, this is what is in Vishnu Purana. So we've already been doing this evidence-based practice for many, many years, even at a very simple thing like even for cough. My grandma would just add a little bit of turmeric in milk and say, you'll be fine. That's evidence-based for me. So what are the advantages of having a practice like this? As I rightly mentioned, it is evidence-based. So it keeps a junior doctor or a senior doctor or anybody medico-legally safe. And that is very important, that you do the right thing for your patient. It's easy to understand. Anybody can follow it. Even the patients have a login into such guidelines where you can go and read about it. For example, if I was pregnant, if I had chicken pox, you can log into the system and go and see what happens in chicken pox, what are the do's, what are the don'ts, what is the kind of follow-up I need to do, what are the complications which I can go through. So everybody can follow it, a clinician, a midwife, a nurse practitioner, and anybody even from a non-medical background can go and read it. And it's the ease of it, it's applicable, the knowledge is applicable worldwide. No one can say, oh, this is not possible in my country or in my town or my village. It's easy to practice for anybody, and it is ethically right because it keeps you right, and keeping yourself right as a doctor is so much important. And where does this all lead to? This leads to the need of the hour. If we can integrate yoga into our conventional practice, it would be a win-win situation. We all talk about multidisciplinary approach. What's the big deal? Now, gone are the days when your patient comes in, she's low risk, she's 22-year-old, apparently healthy, and she's pregnant, and it's all easy. But now we don't see just that. We see women walking through our doors with kidney transplants. We see patients who are cancer survivors. We also see mums who might be HIV positive. There are a lot of high-risk patients that we see now, and then gone are the days when a gynecologist or any doctor can say, oh, I can treat everything under the sun. I think gone are the days. Now it's better, it's safer, it's also ethically right to have a multidisciplinary approach so that we inculcate and we incorporate different fields of specialties, different experts from different specialties to give us their expert opinion, and rather than saying, oh, I can treat this. And this is where it comes to what is yoga got to do with all these things. We need to really train the healthcare provider. We don't know everything. Yoga, sky is the limit. I mean, just talking, I can talk for myself. What I know is very, very little. I need evidence-based evaluation. If you can tell me what is the right thing to do, I would like to be trained, and I want to inculcate that and that intervention into our day-to-day practice. And this sort of inclusion and implementation into our conventional practice will be a win-win situation for the patient as well as for the doctor. And this is what is the need of the hour. You can see that red line running where from age 0 to golden age, the hormones go up and down. And it's never a space in a woman's life where the hormone is not causing a havoc. It can do a lot of things like that. So this is where if we can unlock the potential of yoga and help the mother to understand what is the connection between mental health and physical well-being, and that is what yoga can do for us. Why research? Why is it so important? As I mentioned, we all believe in evidence-based practice, and there's a huge global interest now. I mean, our country has been, you all know how India has transformed in the past couple of decades. And because there's a huge global interest, and for me, I think India is synonymous with yoga, and yoga is synonymous with India. And if we already have enough existing knowledge and on advantages of yoga, and if we can analyze that, and if we can provide information for everybody about it, and hence we can bridge the gap between yoga practice and conventional modern medical practice. I tell this to my patients, for obstetrics or gynecology is more like an orchestra, and all the hormones in our body are like musical instruments. If you want the music to sound like Ilayaraja sir's music, everything has to be synchronous. And yoga has potential, and we all know that it can provide that sort of endocrine support for hormonal balance. Simple things like fertility, where we know that yoga can improve blood flow to the reproductive organs and can hence cause hormone regulation and help improve fertility. And then we also know this enigmatic field of the fetus, how yoga can impact neurodevelopmental fetal programming and provide a positive intrauterine environment for the growing fetus. Yoga has, it has a huge positive impact. Yes, it is a long journey. 40 weeks is a long journey for the woman. Simple things like back pain, feeling nausea, vomiting, heartburn, they all sound like very simple problems. For a woman to go through that kind of impact, that kind of discomfort throughout the 40 weeks and beyond can sometimes be nerve-wracking, especially for a first-time mother. Yoga has enough evidence to say that it promotes relaxation. It builds that sort of mental resilience for the mother to go into this unknown territory of labor, pregnancy, and postpartum. And a woman must be empowered with coping mechanisms to go through this. So this is beyond doubts that medical complications that we see more often now because of our lifestyle, gestational diabetes, or it could be things like pregnancy-induced high blood pressure, hypertension, preeclampsia, preterm birth, and now there's much more awareness on mental health illness in the mother and who is pregnant. There is enough evidence to suggest that inculcating yoga into pregnancy has reduced the incidence of cesarean sections and other interventions in labor. And simple things like reducing labor pain, the impact of labor pain, the discomfort caused, and even reducing the hours of labor which a mother goes through, we know that yoga can do all this. So the baby is born, everybody is happy, we've shared the pictures with everybody, we've said to everybody that we've been blessed with this angel or blessed with a prince and everything. And then the mother. So this part, I wish there was more awareness on postpartum recovery of the mother, because for the mother, it's a new territory. She's dealing with a lot of things. She's first going through a hormonal surge again. The pregnancy hormones are all going away and her natural hormones are coming back, and that can take 6 to 8 weeks for that to happen. And it's a new territory where she's facing newer challenges, breastfeeding the mother, breastfeeding the baby, and then this seems like, oh, what's a big deal? My mom did it, my grandmom did it. It's not easy. It is a new challenge for a new mother, and it can be quite stressful. And what about her sleep? Her sleep cycle is all over the place, and there are mothers who haven't slept for like 48, 72 hours straight. So, and that's where this comes into postpartum blues, postpartum depression, and even worse scenario, psychosis. And we all are aware that yoga can help us with all these problems. And now the mother has gone through pregnancy, she's gone through labor, she's breastfeeding her baby. And what happens to this pelvic floor? Pelvic floor muscles are the ones which support the uterus, the bladder, and the rectum. And then because of the impact of the pregnancy hormones, the pelvic floor muscle is now weak, and that's when the woman is leaking urine on coughing and sneezing as early as 25, 26, 30 years age. You don't have to wait till you're 50 or 60 to go through that. If a mom has had a 3.8 kg baby, talk to her, she will tell you what she's going through. And yoga has a huge impact on that. Now, in our country, even in many parts of our country, there is a lot of celebration when a baby girl is born. There is celebration in some of the communities when the woman attains her first period. There's bigger celebration when when a woman becomes pregnant. But what happens when her periods stop? There's no celebration as such for that. And I don't think anybody even acknowledges that. And it's not a one-day event. Acha, this month I've stopped my periods and it's all done. It's not that. That change, perimenopause, that big word perimenopause, it can go on for a decade. It's a 10-year-long process for the woman, more than that, or slightly lesser than that. And I wish, that sort of celebration is when, people around can acknowledge that this is what she's going through. And we have enough evidence to say that yoga can impact that kind of transformation which the lady is going through, to do with her bone health, her muscle health, and mood swings, hot flushes, incontinence. We know that yoga can have a huge impact on that. So what's the importance? As I mentioned earlier, India is synonymous with yoga and yoga is India. And because we have diverse practices in our country, if we can bring everything under one umbrella and contribute to public health policies so that can be implemented into our day-to-day practice, I think that is what we need today. And there are a lot of things we can do. We can do comparative research where we can compare the impact of different kinds of yoga on the symptomatology, where we can have longitudinal studies where we can talk about a long-term impact and an ongoing studies to say we've done this for the last 10 years and we know that this is what happens, and that sort of interventions is what we need. So because I do mainly pregnancy scans, I spend a little bit more time with pregnant women talking to them. And then once I got this invite for the colloquium, I spoke to a few women. So roughly, I spoke to 300 women who were anywhere between 8 weeks to 36 weeks pregnant. And I just said to ask them randomly, I asked them, would you try yoga? Now that you're pregnant, do you know about yoga? Would you try it? And 260 people out of the 300 said, yes, we would like to do that. And 40 women said, oh, it's not for me. I don't think I can do it. Then we said, okay, we have a yoga practitioner here who can take you through how to do it during pregnancy. Would you like to register? And then the 260 became 160, and 100 people said, well, I did not register because my family will not agree. Or somebody says, oh, I have no time. I won't be able to do it. And then of the 160 who actually registered and who actually joined were only 70. And 90 said, no, because I'm worried about the side effects. So this is the fantastic knowledge we have now. And then also cost. Although it works up, I just calculated and it works up around 300 rupees per session. And they said, no, we don't want to do that. And women who continued yoga, but in spite of registration, 20 women said, I don't want it. That's because her doctor said, you will bleed. If you do yoga during pregnancy, you're going to bleed, you're going to lose the baby. And somebody also said you will go into preterm labor. So that's why I said the practitioner needs, the healthcare provider needs training more than the patient. So this, this is coming from a doctor who can actually access the Google and see what are the advantages, what is the research going in yoga. And so, sadly, there was only 20% uptake for something which is our own. And so those 20% women said, I wish I had more information. I wish I knew about it. I would have wanted to do it even before I was pregnant. So what can we do? Yeah, we need more comprehensive evaluation to talk about efficacy of yoga. There's a lot of things about safety concern. When a woman is not pregnant or when she's not, doesn't have any problems, everything is fine. We don't mind eating pani puri on the road. But when you're pregnant, even simple things you prescribe, or you can tell them, eat this or do this or don't do this. The first question anybody would ask is there a side effect? Why are you not worried about the side effect when you're not pregnant? It's for your own health. So safety concern becomes a bigger issue when there is a baby on board. And so I think we need long-term studies and continuous giving knowledge to practitioners as well as to women. In conclusion, I would say we know yoga is effective. We know it is a harmless intervention. It's easy to learn comparatively. What is of very paramount interest would be not just training practitioners, but also giving them enough information, accessibility about adverse effects. And if we can give an objective assessment about all this, it would be really important in our day-to-day clinical practice to quote numbers to patients and say, this is the number of patients who did it, this is the percentage of women who had fantastic reports, and these were the side effects, if there were side effects. As practitioners, we also like to know if there was a dropout, what was the reason, so that we can work on it. And if there was very good compliance, we would like to know what is that factor, or what are the factors which were really important for the patients to be compliant to yoga practice. And if we can have this kind of evidence-based evaluation, and if we can standardize the yoga interventions into a conventional practice, that would be fantastic. Thank you all. Namaste.
Thank you, Dr. Anju.
Thank you.
And you kept your time very well.
Thanks.
And thank you so much for the enlightening talk. And I think by incorporating yoga into your practice, and whoever, other gynecologists, if they're listening to this, they would do that. And that will create a new generation of healthier babies, both in mind and
Absolutely,
body.
I agree, ma'am. I agree.
Thank you so much.
Sure.
You're supporting pediatrics, actually, by doing that.
By doing that, yes,
Thank
that's
you,
true.
thank you.
Yeah, sure. Thank you very much.
Hello. The next speaker I'm introducing today is Dr. Vinita Nair, who's a well-known pediatrician in the US and now here in Trivandrum. What makes her special to be invited to this seminar as a speaker is her knowledge in yoga, both theory and practice. She's a dedicated yoga promoter and yoga teacher. She graduated from Trivandrum Medical College, completed her residency in pediatrics at Albany Medical College, New York. Following which she held teaching faculty positions at Albany Medical College and later the prestigious Baylor College of Medicine, Houston. Later, she joined as a consultant pediatrician in the United States Air Force and worked as a pediatric consultant at the renowned Wilford Hall Medical Center at the Lackland Air Force Base, San Antonio, Texas. She relocated to India in 2021 and has been working as a senior consultant in pediatrics in Jubilee Memorial Hospital, Trivandrum. Coming to yoga, that's her passion. She completed yoga teacher training course and qualified as a yoga teacher in 2019 from the Om Yoga Sadhanalaya under the expert guidance of Dr. Hetal Naik, who is a doctor herself, who took up yoga practice and teaching as a main profession. She has given talks in yoga and modern medicine in Jubilee Memorial Hospital, SIT Hospital, Medical College, Trivandrum, etc. in the last 2 years that she's been here. She also takes yoga classes. With this introduction, I invite Dr. Vinita Nair to deliver her talk. Thank you.
Thank you for that wonderful introduction, and a very good morning to you all. Thank you all so much for being here. It's really my privilege to be standing in front of such an august gathering, and I really want to thank the organizers for giving me this opportunity. So with that, I'll get right into my topic, which is yoga therapy in pediatrics. Okay, I have no financial disclosures, no conflicts of interest with the material being presented today. And getting into the topic, yoga, as we know, is everywhere. And in recent times, it's become the popular, cool thing to do. And we know that yoga has health benefits which cross specialties and benefit all. And because of this increasing popularity and the obvious benefits, the medical community and the scientific community have shown a greater interest recently. And this has spawned numerous research studies. And we found that yoga, through research, we found that yoga has a scientific basis. And I have a personal interest in this as well. So I'm so happy to be here. Thank you again. So just a few slides to show how popular yoga has become. Yoga, Christy Turlington, supermodels, Eva Longoria, celebrities, they're all doing it. They're on the cover of magazines. Any international airport you go to, you will find a yoga room. Even McDonald's, which is a company that drew a lot of flack for contributing to the obesity epidemic, has kind of tried to change their image in recent years by making their meals more healthy, and they were actually giving out yoga DVDs at one point. The hospitality industry, they are advertising the size of their rooms are big enough to do yoga. This is an ad for Hilton Homewood Suites. And even in children's toys, we have now Yoga Barbie. So there's some interesting numbers just to getting into the topic. Yoga has become so popular, and data just from the USA shows the percentage of active yoga practitioners is only increasing. We went from 5% of people practicing yoga in 2002 to 6% in 2007 to 9.5% in 2012, and then to an exponential rise to 14.3% in 2017. So it's safe to say that very likely more than 20% of the population will be practicing yoga. And the Yoga in America study in 2016 estimated that there were 36 million active yoga practitioners in the USA alone. And not only that, even more significant is that a third of the people who did not practice yoga said that they were likely to do so in the next year. And a large part of this is due to our Prime Minister's interest in this. He suggested in 2014 that an International Day of Yoga be celebrated to foster global harmony. And that was taken up with great enthusiasm at the United Nations General Assembly. And so since 2014, June 21st has been celebrated as International Day of Yoga. This is a scene from that, the very first one. Okay. And yoga has actually found its place on the National Institute of Health. There is a branch of the National Institute of Health called the NCCIH, which is the National Center for Complementary and Integrative Health. And Josephine Briggs is the director. And she has come out publicly to say that the yoga, it's very noteworthy that yoga has become so popular because mostly healthcare trends tend to remain stable over time. So there's yoga. Yoga has its place on the NIH webpage. And so because of this huge interest, it's led to this whole new field of yoga therapy, which is the application of yoga for therapeutic purposes and as preventive medicine. And because yoga is now being used as therapy, this has led to an increase in research as well as clinical trials. And these are, now it went from small little trials in people's homes to giant trials that are now supported by the NIH, NCCIH, and the government of India. And these numbers are a little bit old. There's a new review that's due to come out in June. But the numbers have gone from about 100 back in 2003 and grew to like triple of that in 2013. So you can see how yoga therapy has come a long way from this obscure brochure from the 1920s from the Kaivalyadham Institute to the innumerable resources we have at our disposal today. So my goals of this presentation today is not just to talk about pediatrics, but I just wanted to give an introduction to yoga as a whole and talk about the scientific basis of yoga. And with that, provide a psychophysiological rationale for the use of yoga in the pediatric population. Give a very brief overview of the yoga research that is out there in children and adolescents, and discuss its application as a complementary mind-body therapeutic tool. So how does yoga work? We all know that yoga works. So obviously there are lifestyle factors. Yoga involves activity. So by increasing your activity and then following the guidelines that yoga entails with regards to diet, that will of course make you feel better, whatever condition you may have. Yoga, everybody knows that yoga improves sleep. But the actual scientific basis of yoga, which is so important to understand that I just did not want to leave it out of my talk today, is yoga works by decreasing the activity of our sympathetic nervous system and downregulating our hypothalamic pituitary adrenal axis. So it reduces the downstream harm that is attributable to chronic stress. And stress is universal nowadays. We are all under stress. And it's not single traumatic events. It's a chronic low level of stress every day that is even more harmful than a single event. So with that, let's talk a little bit about yoga and breathing, because every single practice has an effect on stress. So the ancient yogis put great emphasis on breathing practices. And as we know, our breath has a tremendous influence on our nervous system. When we get nervous, we breathe faster. And if we take a few deep breaths and sit down, we naturally calm down. And our nervous system is our core, right? It coordinates most activities of our cellular environment, all our physiological processes, and our emotional responses. And it has a central role in maintaining our balance, our homeostasis. And breathing is part and parcel of yoga. It's not done independently of postures. And so strengthening and balancing our nervous system is a key component of physical and emotional health. And pardon me, the next few slides are all physiology, but it's important to just get that good understanding of why and how yoga works. So our autonomic nervous system. This is the oldest branch of our nervous system. It's been evolving in us over 320 million years. It regulates our survival functions. We cannot live without our autonomic nervous system. And what I mean by survival functions are the things that just happen automatically without us knowing it. Our heartbeat, digestion, reproductive impulses, the ability to sense and respond to danger. The autonomic nervous system is made up of two complementary systems, the sympathetic and parasympathetic. The sympathetic system operates when we move towards activity, and the parasympathetic operates when we are in a more inactive or restful state. And our rate of respiration is associated with the balance between sympathetic and parasympathetic systems. So our sympathetic system, think fight or flight. It's functioning 24/7 to keep us ready to fight a challenge or be prepared for some kind of danger. Not only that, our brains are hardwired to learn from what is called a negativity bias. That just means that we tend to register and learn from negative information and experiences more quickly, right? Like you go for an exam, you remember all the things that you did wrong, right, rather than what you got right. So we are evolutionarily, we are always on a state of high alert, much more than we need to. We are in sympathetic overdrive most of the time. The parasympathetic nervous system is the opposite. Think rest and digest. It rules the functions that are related to growth, repair, restoration. And the vagus nerve is the large bundle of nerves that really controls the parasympathetic nervous system. And these are both complementary. Think of an accelerator and the brake of a car. That's how they function. So just a mention of the vagus nerve. This is the oldest branch of the parasympathetic nervous system. It travels to all the organs above and below the diaphragm, and that's where it gets its name. Vagus meaning the wanderer. That's where we get our word vagabond. So vagal tone, that is an important aspect. That is vagal tone, what that means is how well is your vagus nerve functioning. That is an important aspect of physiological and emotional health. So vagal tone, when your vagal tone is low, that means your vagus nerve is not doing its job very well. When you have low vagal tone, that is associated with conditions of inflammation, high blood pressure, seizure disorders, anxiety, depression, many more. Whereas your vagus nerve is working well, your vagal tone is high. That is associated with reduction of inflammatory conditions, better cardiovascular health, a high heart rate variability, which I'll talk about in my next slide, improved digestion, better sleep, and positive mood regulation. So what is heart rate variability? The reason I'm talking about this is how we measure your vagal tone. The heart rate variability is the beat-to-beat difference in our heart rate. You take the best example of this is what we call sinus arrhythmia. All the doctors here, I'm sure, know this. You take a deep breath in, your heart rate goes up. You breathe out. When you exhale, your heart rate goes down. So if the heart rate is not decreasing appropriately on exhalation, the so-called vagal brake is not functioning well. And that means you are in a state of sympathetic overdrive. And then just a mention of the HPA axis, which is downregulated. I mentioned that yoga works by downregulating the HPA axis as well. The HPA axis is another thing that gets activated when we are in a state of danger or we have to face a challenge. And stress from that causes the release of adrenaline and then cortisol, and this helps us prepare for a challenge. But a constant stress, this helps in the short term, but if we're under constant low levels of stress, we have an oversecretion of hormones and neurotransmitters when we don't need it. And this excess cortisol can do more harm than good. And it also has been shown to attach to receptors in our prefrontal cortex, which is the area of our brain which helps us to respond to things thoughtfully and not just on an impulse. Okay, so back to our original question, how does yoga work? Nearly every yoga practice, in one way or the other, is related to strengthening our vagal tone, be it the postures, the breathing, the vocalizations or chanting that's related with yoga, and the behavior modifications. All these are modified by yoga. Every single practice of yoga has been shown to increase vagal tone. So that's why I spent so much time talking about that. Okay, so we'll take a little break from science and physiology now. This is my personal interest in yoga. This is just a picture from my yoga teacher training graduation in San Antonio, Texas. I was very fortunate to, I've always been passionate about yoga, and I've loved yoga since I was little, but actually becoming a teacher and learning about yoga in depth was life-changing for me. And this is my, my graduating class, and that's my teacher in the middle, Dr. Hetal Naik. Okay. So why do we need yoga therapy in pediatrics? Well, unfortunately, children are very stressed these days. They have numerous, more choices than they need to have in every aspect of their life. And now with social media and all kinds of things, they're constantly being stimulated, and they are in a state of sympathetic overdrive more than we realize. Not only that, yoga therapy has been shown to improve conditions in which modern medicine has limited benefit. And it goes without saying that asana practice is much easier when started young. Children are naturally flexible. And of course, prevention is better than cure. Start early before problems manifest. It says so in the Patanjali Yoga Sutras. Heyam dukkham anagatam. We can avoid the suffering that is yet to come. So a quick review of the published literature. There's not a whole lot of pediatric literature out there, but I'll touch on the few studies that are there. If you do a search on PubMed using the search terms yoga, child, pediatric, you will get nearly 500 citations. But most of these are preliminary, uncontrolled studies with design limitations. But these pilot studies are important for documenting the safety of yoga, and the sheer volume of these studies demonstrates how applicable yoga can be to the pediatric population. And there are pilots existing for conditions all over the place, anywhere from autism spectrum disorder to intellectual disability, even cancer conditions. So I'm just going to talk a little bit about the randomized control trials, the high quality studies that exist. At the time of the last review, there were 13 randomized control trials. There are many more now. And the literature in pediatrics falls into two distinct categories: yoga for children with physical health challenges and yoga for psychosocial well-being. So the one study I wanted to talk about regarding physical health conditions is with irritable bowel syndrome. If there are any pediatricians here, I'm sure you are aware what a difficult condition chronic abdominal pain can be to manage. And now we know something about irritable bowel syndrome, but we still don't know what exactly causes it, how to manage it. And so naturally, yoga was something that was looked at in the research. So there are two good randomized control trials that were done. One had 25 teenagers randomly assigned to yoga versus a control group, and the yoga group had decreased pain and anxiety versus the control group. And a similar study, but more recent, had 30 teenagers, and they reported significantly improved physical functioning on the whole and decreased pain. The problems with these studies were a small sample size, a lack of active control. Either you did yoga or you did nothing. There was not an active thing that the other group was doing. Dropout rates, attrition rates, and the difficulties in home practice. Okay. And we had a wonderful talk just now from Dr. Anju Namasivaya about yoga in women's health. But I wanted to also mention yoga and PCOS because this is one of the best randomized control trials to date. It was an RCT involving 90 teenage girls by Nidhi and colleagues in 2012. There was a yoga group and an active control group. And there were 3 publications from this study. And the first report revealed a significant change in anxiety. The second and third reports showed improved fasting insulin, fasting blood glucose, lipid profile, normalization of testosterone. And this series of findings provides the strongest evidence to date for efficacy of yoga in treating a pediatric condition. And now coming to wellness, RCTs of yoga for psychosocial health. Studies looking at yoga as a therapeutic tool for children with intellectual disability, impaired socialization, ADHD, eating disorders, among other things. There was a study in 2004 which showed yoga would be useful as a potential complementary treatment for children who have ADHD who are on medication. There was another high-quality study in 2010 by Carey and colleagues looking at the effect of yoga and eating disorders. And in this study, both groups demonstrated less anxiety and preoccupation with food, but more so in the yoga group. And the notable thing was that in the yoga group, the effects were much longer lasting than in the control group. And so this naturally brings us to, how do we introduce yoga to children? Schools. It's one of the easiest and best ways to introduce yoga to children early on. A number of RCTs have actually looked at yoga within the school curriculum to look at its efficacy as a preventive measure for child wellness. And there are 2 randomized controlled trials by Khalsa and colleagues that demonstrated that yoga has the potential to prevent mental health disorders in teens. And both of these studies showed improved mood, decreased anxiety, and intrusive thoughts. And this is my experience with yoga in school. I was actually given the opportunity to teach yoga in an American school as part of their physical education. And I just want to tell a quick little story here, just an anecdotal experience, but it was significant in that I had 20 minutes to teach groups of children as they were coming in. So they would come in, do 20 minutes of yoga, go outside and do 20 minutes of something else. And so each group came in and out. And so it was a very quick turnover. And some of the children were outside doing their other activity, and that day it happened to be archery. And so some kids did that first and then came and did the yoga, other kids did yoga first and then went out there. After about 3-4 sessions of this, the archery teacher came inside and she was peeking in the door and she was like, I just wanted to see what you're doing in here, because the children that are doing the yoga first and coming out to do the archery are doing so much better. They're focused, they're hitting their targets, so I wanted to see what kind of magic you're doing in here. So that to me was one of the greatest things I've ever heard as a yoga teacher. Thank you. Okay. And this, I wanted to mention, these are slides shared by my very good friend and classmate, Dr. Ishwar. He's a very accomplished pediatric orthopedician in Calicut. And he was telling me about a series of 6 patients, all under the age of 15, who had severe back pain, documented intervertebral disc prolapse on MRI, who were already posted for surgery. And he offered them a trial of yoga just to see what might happen. And this is the pictures in this are kids who could not walk. They could not walk. They had bladder disturbance. They could not even raise their leg more than 20 degrees. And this is after, so unfortunately I don't have a before picture, but this is the after picture, after 3 months of yoga. And these 6 patients, none of them ended up going in for surgery. And also worth mentioning, not everything is rosy. Not all the studies that have been done demonstrated support for yoga in alleviating or preventing mental health problems. It is noteworthy that there were 2 randomized controlled trials that recently showed a positive effect of greater coping skills, but also a greater appraisal of stress and a negative affect. So meaning that people were just more aware of their stress. But that is a byproduct of yoga. Yoga, it's like my yoga teacher used to say, it's like an internal churning. All that bad stuff has to come out first. And that is part of the mindfulness. Okay, so in conclusion, with the literature review, the large majority of studies that are out there have shown benefits for children with specific conditions. It's not clear whether these benefits translate proportionately to children who are well. But from our brief literature review, we can summarize that yoga may be the most powerful when treating an underlying condition, and its application in a preventive setting with well children may be less apparent because of the short time course of studies conducted to date. Yoga is not a quick fix. It is a long-term thing. Okay, and I just want to mention Satbir Singh Khalsa, without whom I could not give this talk today. He is an expert in the field of yoga. He's a professor of medicine at Harvard, but a pioneer in yoga research. And he is the person who has done all the reviews of the studies that are out there. It's painstaking work. Okay, so the future of yoga therapy in pediatrics, it's encouraging to see that the newer studies have improved designs and better reporting, larger sample sizes, and better reporting of adverse events. And things that to look at for the future, specific asanas, the effect of specific asanas. No one has studied this so far in pediatrics. And hopefully, future research will be more refined and help us to understand the use of yoga in the pediatric setting. And another area worth exploring is developmental tailoring of yoga interventions, a different program for teens versus younger children. And that brings me to the next thing I wanted to say. This is Om Ashram in San Antonio, which is where I learned yoga. It was not an institution at the time, it was just starting. But they have something called Yoga Sopanam, which is kind of a roadmap for children to learn yoga. This is something that they have developed. Any other physical activity you look at, dance, karate, whatever it may be, there is a roadmap and different levels, and there are different goals that you have to reach before you can go to the next level. So that makes it easy and interesting for children as well as for the teacher. So this is a beautiful thing that they've done that we can certainly bring into our practice here.
Time is up, Vinita.
Okay, so thank you all. That brings me to the end of my talk. I want to thank my guru who put me on this path, my family who has always supported me, Om Ashram, and my friend Dr. Ishwar. Thank you all so much.
Thank you, Vinita. That was a wonderful talk. I wish we had more time. I'm sure you had many more things you wanted to say. Maybe another time. Okay, thank you. If anybody has any questions to either speaker, please use the time for that.
Thank you. My name is Sunil Rajan. I am a GP based in Brisbane, Australia, and I consider myself a holistic practitioner. I've been a yoga practitioner. So thank you very much, speakers, Dr. Anju Namasivaya and Dr. Vinita, for their excellent summary. First question is to Dr. Anju, if I may. We anecdotally, we all know the benefit of yoga, and we are talking to the converts here. Most of the people here have a bias towards accepting the evidence. But during your preparation for this talk, did you find any evidence to suggest, particularly yoga, the bandhas? In Yogasana, there are bandhas, which is part of the yoga. Have they been studied for pelvic floor health?
Yes, there are a few studies that are specifically talking about yoga, particular asanas, which I read through, which improve the health of particularly pelvic floor muscle strengthening as well as blood flows. Yes, I found few of them on NICE guidelines, and National Institute of Health. Few of them were there.
The reason was an observation that in the past, many of our, especially our grandparents, had numerous children. The multi-gravity was quite common, 12, 15 pregnancies. And yet, anecdotally, from older doctors, we never had this large incidence of urge incontinence and urinary incontinence and other problems. But in our traditional system, we had a squatting as a form of defecation and micturition. And so clearly there is some engagement of, although it is not class yoga, but there is some engagement of pelvic floor muscles there. So that was why I asked that question.
Yeah, also specifically the way we cooked before on traditional fire-lit gas, not the gas ones, but with wood, and that would always be at that level, and we would be sitting down, and making chapati also would be sitting down, grating coconut would be sitting down, and washing clothes, bathing children, simple things like bathing children, washing clothes would be sitting down. Now we don't do any of that at all, unfortunately. Even the babies go in the tub to bathe. So, yeah.
Thank you.
Thank you.
Sorry, if I may, my second question was to Dr. Vinita. I'm sorry, I don't want to hog the space. Because yoga is movement, and then we know ADHD and all those conditions, the current generation, we have an explosion in the number of children being diagnosis of ADHD and other autism spectrum. But we do know that the lifestyles have changed, there is less social interactions and all that. And movements are less, they're not going out and playing as much. And so yoga is just another form of movement. I'm just seeing if there was any evidence to suggest that other movement therapies have any role to play in the management of ADHD?
Yeah, that's a very good question, and actually, it's good that you mentioned that because I couldn't go too much into detail in each study, but the studies that included an active control group, that is not just a simple control group. One group did yoga, and the other group did a non-yoga physical intervention. There were improvements noted in both, but what was notable across all the randomized controlled trials that were done was that the effects were more sustained, much more long-lasting in the yoga groups. And it was also the sense of calmness, the decreased anxiety, that was much more so in the yoga group than the simple physical activity.
Hello, can you hear me? Yeah, okay. I just had thank you so much for your presentation. Okay, I'm actually a clinical psychologist and I practice in Australia. I was just interested to know more about what your understanding is about the parasympathetic nervous system, because it seems like there's two aspects of it. So there's the aspect where it calms you and relaxes you, but then there's the other aspect where it also you can go into a parasympathetic sort of state where you go into a freeze mode or into a fawn mode, and you just kind of stuck, you get stuck there in depression and dissociation and numbness, sort of. So do you think that yoga would help in that, or could have some kind of an impact on that area? Because there's, it seems like we don't talk about the other side of the parasympathetic nervous system function.
Yeah, another great question. And it's true, we don't talk too much about the parasympathetic nervous system because unfortunately we are, by evolution, we are in a state of sympathetic overdrive. So I would say, that's how, as human beings, that's how we are wired. So no matter how dissociated or depressed you are, the sympathetic is going to kick in when you're in a true state of danger. And yes, yoga can certainly help with that, because yoga is all about balance. It's not doing one versus the other. So we don't want to eliminate our sympathetic, because we cannot survive without our sympathetic functions. But we just want to bring back the parasympathetic functions to where they should be.
So, have you had any experience at all with pranayam or anything that actually kind of can, propel someone out of that state of, numbness? Because I think that's a very apparent traumatic kind of result. Like, that's where people get stuck.
Yeah, I have personal experience with those some of my colleagues and fellow yoga practitioners who did the yoga training with me. There were people who had depression, postpartum blues, people who were on medication, and actually I'm amazed to say that they not only did they recover, they got off their medications. Yeah. So that's my personal experience. I don't know, but I'm sure there is research out there to show it as well.
Okay. All right. Thank you.
Thank you.
Ma'am, I have a question to the second speaker. I'm a certified yoga teacher, but basically an engineer by profession. Do you have any evidence on treating patients with PCOS? So they say that it's an incurable disease, accompanied with weight gain and hormonal imbalance and type 2 diabetes. My question specifically is to do something related with Ayurveda also, wherein I have read that women who consume water which is exposed to moonlight and they have it in the morning, it's supposed to cure PCOS. Do you have any kind of evidence or proof or any knowledge on this particular matter?
Okay. As a gynecologist, I believe that every woman is PCOS at some stage in her life. Because PCO is, although we're talking about polycystic ovarian syndrome, it's a condition where the ovary has innumerable numbers of cysts, immature cysts, which cause a lot of hormonal imbalance. And this is where I talk about gynecology being orchestra. And all these hormones which are coming away from the ovaries can impact. So every woman at some point can be polycystic. So with slight increase in weight, even as little as 2 kgs can have a huge impact on the ovaries. And it's because of the excessive estrogen which is produced. Now, once the woman has gained weight because of an impact of polycystic ovaries, the fat, visceral fat, the fat which is stored around the organs, they start producing estrogen. The ovaries are already doing that, and to add on to the trouble, there's more trouble where the fat from outside the body, from outside the ovaries, but in the fat tissue covering the other organs, they also start producing estrogens, and then there is that hormonal imbalance. So treating polycystic ovaries depends on what is the problem. Women come to you only when there is a problem. So it could be a teenager coming to you with irregular periods where the family is worried she's not having her periods, to a little, when the periods are all okay, but the woman is still PCO. That's because of hirsutism, excessive hair growth, and striae on the skin, dark marks on the skin. So then that is also an impact. And then in diabetes, as you rightly mentioned. And then once they come to an age where they are, they want to start a family, and if they are PCO, and then they cannot conceive. So it's to need basis is what gynecologists come across treating patients. And I would say PCO is treatable depending on what is the result you're looking for. It is not it is not something which is like, there is an objective assessment. If I see a couple where the mother is, the lady is PCO, and if her aim is to get pregnant, and if she gets pregnant, and if she has a baby, her PCO is treated according to her. It's more subjective rather than objective. So yeah, we do need a lot of research to understand, and I'm sorry, I cannot comment about the Ayurveda part of it because I am not an expert in that field.
Thank you, Dr. Anju. This brings us to the end of this session. And if anybody has any more questions, they can discuss during tea outside. Thank you.
My question to the first speaker. Hello. Is there any set practice you suggest for pre and...
Hello? Time is over. Oh.
Time is over?
Yeah. I just announced that.
Okay.
Okay, thank you.
Thank you so much. Please do not take any offense. It's not personal at all. We want to keep to schedule so that the people who have to leave this evening get a chance to hear everybody. So now we move on to the felicitation. We would request our chairperson to please present a memento to our 2 speakers. And while she's doing that, we'll make Madam, with your permission, one small deviation, because there's a person here who says that she has something to declare on being treated from PCOS after yoga, and she's promised to keep it for 1 minute.
Hi, good morning, everyone. I'm going to make it less than 1 minute. I know we're short of time. Really sorry about this. But I think it's important to tell this at this forum in the presence of yoga teachers, yoga practitioners, and doctors. So I was diagnosed with PCOS way back in 2017, and I went over to my gynecologist, and the only solution she told, I had a 6 centimeter cyst in my left ovary, and at the time of surgery, I had multiple cysts. So I was suggested to take surgery, and that was the only option. And I was also told that if you want to get pregnant, do so now, and some of the cysts will just get flushed off when I give birth. Obviously, I didn't want to get pregnant at the time, and I didn't have any other options, so I went ahead with the surgery. And I was suggested to take hormone tablets, which I didn't want to because I've heard a lot about the side effects of hormone tablets. And I had just started my yoga journey at the time. And luckily, I got into therapy yoga, and my wonderful therapy yoga teacher, she made me do asanas specifically for PCOS, and I had a knee problem also at the time. And over the course of time, I went over to do my TTC. So I'm a certified yoga teacher as well now. And fast forward to 5 years, 2024 now, I do not have an occurrence of PCOS. I've been doing my ultrasound every year. And I just wanted to probably add one statement here that it's not just yoga that had helped me, but it's also a lifestyle change. So we cannot test the result of yoga by treating it as a capsule and you come over and do some tests and run some tests on this patient. You wouldn't see the results. So it's a huge lifestyle change along with the practice, along with the asanas, along with the breath, which is very important when you do the asanas. And that inculcates and produces a result which will go ahead for, go on for the rest of your life if you're into it and if you keep practicing it. So I'm so sorry, I just took this moment because I thought it was very relevant for the larger audience and as evidence to your studies as well. Thank you.
So we request everybody to be back by 10:35, please.